Did your doctor prescribe prednisone 60 milligrams? If so, this video is for you. I'm going to talk about what prednisone 60 milligram is, what it's normally prescribed for, what side effects you can expect, and how to take it. First, I'll talk about how to take it. So, prednisone 60 milligrams is often prescribed short term. It's not normally something that's long term. And there's a typical dose that you'll often hear in the pharmacy as a pharmacist like me. I'm a doctor of pharmacy, board certified. And it would be 60 milligrams every day for 5 days. So, how do you take that? Well, you can't buy 60 milligram tablets. You can buy 20 milligram tablets or 50 milligram tablets or 10 milligram tablets. So you could either get a 50 and a 10 or just take 3 20 milligram tablets. And you wouldn't take them spread out throughout the day. You take them all at once, first thing in the morning. That way it's mimicking your body's naturally occurring hormone called cortisol. And first thing in the morning with a glass of water, and then you could eat your food. You could wait to eat with your food, but it's best if it's really first thing in the morning to mimic how your body naturally is. And then you take that every day for 5 days. And then often that's the entire prescription that the doctor prescribes, and you can just stop taking it at that point. People are wondering, do I have to taper? And often you don't need to taper when it's only 5 days, and usually up to about 10 days. You don't need to taper. Beyond that, you do need to taper, and I will get to tapering at the very end. So, what is prednisone 60 milligrams? Well, it is an amazing medication that is an anti-inflammatory and immunosuppressant medication. Often a dose this big is prescribed for a really big reason, such as giant cell arteritis or vision loss from multiple sclerosis or a really severe inflammatory or autoimmune condition. Somebody who has another kind of arthritis, like rheumatoid arthritis, would be somewhere between 5 to 15 milligrams. So this is like 10 to 4 times greater than a normal dose of prednisone. This is high dose prednisone. This is usually the highest dose that is commonly prescribed. And beyond that, a doctor could prescribe like up to 100 milligrams, and that might be normal. But beyond 100 milligrams, that's incredibly rare and is usually only done in the hospital. And by then, it's usually an IV version. So 60 milligrams is really high. And literally, they don't make pills this big. So you have to take multiple pills to get to this point. I personally had to take this much when I started taking prednisone. This was the dose I was given for my autoimmune disease, ITP, immune thrombocytopenia. I would have died without it. I would have bled to death. So I'm so grateful that I was hospitalized and able to take this medication to save my life. And so my first tip is make sure that what you're taking it for is really legitimate. Do not take this unless it really is severe enough to justify the side effects I'm going to share with you in just a moment. Other conditions that might justify its use include severe allergies, incredible itching, swelling. Hay fever is usually not enough unless it's really extreme, like somebody has a horse allergy or something, that it's life-threatening. And cancer treatment. Sometimes prednisone is used as part of chemotherapy for cancer and is often used to help with minimizing the nausea and vomiting associated with chemotherapy. It's incorporated as the P part of the acronyms that the doctors prescribe, like CHOP, R-CHOP, all of these different lists of medications. Prednisone's often included, and it's powerful. It helps with the immune system and with the nausea and vomiting. So what side effects might you expect that can be severe? I personally experienced all of these side effects, and it was awful. Taking prednisone felt like making a deal with the devil. It was saving my life, but I felt miserable. And it can cause up to 150 side effects. But which of those side effects are worse at higher doses? So there's not a lot of great research on this, but I compiled all of the side effect lists from all of the best resources, Lexicomp, Micromedics, Up to Date, the Drug Package Insert, and many others to try to consolidate and find which side effects are listed according to those lists, as worse at high doses. None of them specifically said at 60 milligrams, but at high doses and extremely high doses is what we're going to be talking about. These are side effects that are dose dependent, that they get worse at the higher doses. So prednisone is in the class of drugs called glucocorticoids. That means it's classified because of what it does to your metabolism, to glucose, glucocorticoids, glucose meaning sugar. And so the first thing that prednisone is going to do that most people notice pretty quickly is it changes your appetite. It changes your metabolism. It changes the way you deal with sugar. And when you're on a dose that high, it often makes you just feel so hungry, you want to eat the legs off a table. You crave foods that are not good for you, like Oreos, things that are high in sugar and high in salt, high in fat. Things that are easily consumed are what your body's telling you to do, which I don't recommend following that advice from your body. Eat a healthy diet. And the blood sugar changes above 30 milligrams, you have a 10 times greater risk for high blood sugar. Just imagine what it is at 60 milligrams. I don't have a study that shows that when we're at twice the number of milligrams. So maybe it's 20 times greater risk. I don't know. But your chances of blood sugar changes are pretty high when you're on that high of a dose. I personally passed all of my pregnancy blood sugar tests with flying colors. I did not have diabetes during pregnancy. But when I was on prednisone, I did have high blood sugar, especially when I was on prednisone and chemotherapy at the same time. So it definitely happens even to young, otherwise healthy people. And it's more likely, the blood sugar changes are more likely in older people and women. Related to that is the fat redistribution. So prednisone takes the goodness, the muscles, the fat from your arms and legs, redistributes it to your belly and your face, leading to moon face. And moon face is worse the higher the dose. And so when you're on 60 milligrams, it's possible to get moon face after just 2 weeks of 60 milligrams. Some people it will be 2 months. Some people it will be never. But it is possible to get it sooner and rounder at the higher doses. People who are on extremely high doses will get very round faces. And the lower the dose, the less likely to have moon face. If you're just taking 60 milligrams for 5 days, it's really unlikely that you're going to get moon face. But if you're on it for 50 days, it's pretty likely you're going to get it. All right, so now let's talk about your head. We've already talked about the moon face, but what about your brain? Prednisone is going to potentially change your mood, change your personality, and the higher the dose, the increased risk for mood complications, emotional disturbances, and psychiatric side effects. The higher the dose, the more likely the depression, the mania, and even psychosis. This actually has its own diagnosis code, steroid-induced psychosis, and it is more likely at higher doses. You can get delirium, you can even get dementia, brain fog, memory problems. Related to that is insomnia, because prednisone is mimicking cortisol, which has to do with your circadian rhythm and sleep and wake and things like that. Your body is actually suppressing your ability to make melatonin and is interfering with your ability to get restful sleep. And so insomnia is a possible side effect. It is, in fact, the number one tweeted side effect. And the higher the dose, the more likely the worse sleep you will get. There are some things you can take for that. You can take melatonin to give back what prednisone is suppressing. You can take magnesium. You can use deep breathing exercises. Listen to an app like Calm or Headspace to help you get restful sleep. Those are some things that have helped me and other people struggling with insomnia from prednisone. Next, prednisone can affect your blood pressure and your heart. So the higher the dose, the more likely it's going to lead to high blood pressure and potential heart complications. It can lead to arrhythmias, it can lead to stroke and heart attack and other cardiovascular complications. And so minimizing sodium intake, like only eating the minimal amount of salt that you need. Make sure you stay physically active within the bounds that your doctor gives you. Can help control your blood pressure and getting restful sleep, but that's pretty hard to do. Next are muscle changes. So I mentioned this briefly, but prednisone can cause muscle loss and muscle pain, myopathy, and it's stealing the nutrients, redistributing the fat and the protein, making you waste protein, and that is definitely a problem. So it's definitely recommended to, again, do as much exercise as your doctor allows. Do strength training, weightlifting, walking, moving your body to minimize these complications. Related to that is bone loss and osteoporosis. These side effects are definitely dose related, and you're likely to lose more bone mass at higher doses, but it seems to kind of reach a threshold. And the longer you're on prednisone, the worse it is. But the biggest percentage loss of bone mass is in the first 3 months. So you don't want to wait to take precautions to protect your bones and your muscles. You want to be taking care of your body the whole time you're on prednisone if you can. All right. Finally, some things that were labeled as high dose. Worse side effects include changes to skin that are due to hormone changes. So when prednisone is at a lower dose, it doesn't have as much opportunity to kind of switch to other hormones that are floating around in your body. But when you have 60 milligrams of prednisone, your body's like, what am I supposed to do with it? And there are enzymes that might turn it into other steroid hormones, like sex hormones, like testosterone or estrogen and progesterone. And so it's possible that you might switch into these male sex hormones like testosterone, androgens, DHEA, things like that, and lead to male pattern side effects. So whether that's hirsutism, like facial hair growth, or alopecia, hair loss, and it could be male pattern hair loss or just general thinning of the hair. And then even acne in the beard area, essentially, or even anywhere. But these changes are more likely at higher doses. So I promised you a tapering schedule for how to taper prednisone 60 milligrams. And this is really dependent on your disease. You never want to taper unless your disease is under control. And so working with your doctor, this is a possible taper schedule you could use. If you want to do a more aggressive, quicker taper, you could jump from 60 down to 40, down to 20, down to 10, and even off at that point. That's super aggressive. And each of those could be over 3 days, 5 days, a week, a month, whatever, depending on your symptoms. Or if you wanted to be a little bit more conservative, you could go 60, 50, 40, 30, 20, 15, 10, 5. And usually around 10 is where some people get problems and have a hard time tapering, and you could even go slower at that point. But those are some ways you could taper prednisone, and each of those drops is generally a week, but it could be a different timing. Whether it's 2 weeks or 2 days, it's generally some multiple of 5, like 5, 10, 15, 20, or a multiple of 10, 60, 40, 20, 10, right? Is usually the numbers that they use because that's the numbers that the milligrams of the pills are. Like, for example, this one's 20. It also comes in a 10, a 5, a 2.5, a 1, and a 50. So that's generally how the taper works because that's what's available to use. And tapering should always be done slowly under the guidance of a healthcare provider. And generally, back to the very beginning, unless you're only taking 5 to 10 days of 60 milligrams, you never want to go cold turkey because that could lead to potentially going into adrenal crisis. Prednisone is replacing your body's adrenal hormone, cortisol. You have no ability to make that right now. Your hypothalamic pituitary adrenal axis, HPA axis, is turned off. So never go cold turkey beyond 10 to 14 days. Like, it is a recipe for disaster, and you could lead to adrenal crisis, which could lead to death. So always follow your doctor's instructions. If they say you can, then you can, but do not do it without the guidance of a doctor. Finally, one of the perks of prednisone is it helps control autoimmune conditions. One of the negatives of prednisone is it leads to increased risk for infection. So be sure to be looking out for that too. So to conclude, prednisone 60 milligrams is an amazing, potent medication. It saved my life. It might be saving your vision or your skin or something. It truly, as a Harvard professor put it, is one of the most amazing medications. It is also one of the most the worst medications because of the side effects that it can cause. So be sure that every single milligram matters. I'm the prednisone pharmacist, and it's my mission to make sure that everybody taking prednisone is taking the lowest amount necessary for their condition to minimize the side effects so that you don't feel so awful. And if you want to know my best tips for how to counteract side effects from prednisone, I have a prednisone checklist. Even if you're only taking prednisone for 5 days, the things I outline in this checklist are easy to do and are what you need to do to prevent long-term complications. So just click the link below to download your very own prednisone checklist now. Signing off as Dr. Megan, your prednisone pharmacist.